The Republicans in the House and Senate have reached a deal on their sweeping tax package. Two Republican sources familiar with the deal tell NBC News that the bill would repeal Obamacare's individual mandate, a key piece that requires everyone to buy insurance or pay a fine instead. I want to bring in NBC News medical correspondent Dr. John Torres. Is this essentially the end of Obamacare as we know it? What happens to it without the individual mandate?
And Craig, it's going to be virtually impossible for Obamacare to continue without that mandate, because that mandate requires healthy people to buy into the insurance pool. Without that, premiums are going to go up, deductibles are going to go up, co-pays are going to go up. It's going to become more expensive for people that do have insurance. And we have a perfect example of that. We met a gentleman named Joe, middle class. He's working, he's a paramedic, he saves lives. He has a prosthetic, he's an amputee, an advanced prosthetic that lets him work. Without that, he wouldn't be able to. This is going to have a major impact on him.
It's a lose-lose for me. Increased premiums it's going to hurt my family. It's going to hurt me. It's going to hurt, our ability to keep our bills paid, keep our lights on, to keep food on the table.
And if you look at his bills itself, the medical bills, not including his prosthetic itself, they're 23% of his income.
23%?
23% of his income. So it's a huge amount for him. And again, that's not including his prosthetics. You can see that as premiums go up, as deductibles go up, it's going to cause more and more issues for him.
What about the medical deduction? That was one of the most hotly debated health issues in the new bill. I know the Senate wanted to keep that deduction. The House wanted to kill it. As of right now, it's in the compromise. Who would that affect?
Well, the big worry is that it's going to affect people that have health conditions. And what we know is that if people don't have health insurance, they're not going to get health care. That's the big thing. And so the advances we made in prevention, the advances we made in chronic care are going to slip back to what they were before 2010, when people let them get to an advanced stage and then usually ended up in the emergency room with big, big impacts on their health. We don't want to go back to that.
How much of a deduction were we talking about here?
It depends on the individual itself, but there's 8.8 million people that actually can get this deduction. 10% of the income is what you really need to hit in your medical bills. It's affecting that 8.8 million people in America. Usually most of these people are over the age of 65. Most of these people are under $75,000 in the amount of money they make. And so this is hitting the people that don't need it to hit them the most.
All right. Dr. John Torres with a bit of a deep dive there into what this bill might mean for us from a medical perspective. Thank you, sir. Thanks as always. The White House set to brief reporters any moment now. They're in the briefing room. They are running just a few minutes behind, as is frequently the case. Sarah Huckabee Sanders expected to take to the podium there in a few moments and answer reporters' questions. When it happens, we'll take you there.